I knew I had been pushed into the past the moment the CEO's daughter refused to look me in the eye and called me an obstacle to the future. Her words hit the conference table like a block of ice. No one reacted, but I felt it as clearly as daylight. I had just been moved into the category of old furniture they planned to haul away before the company entered its shiny new era. And that was only the first 10 seconds of this morning's meeting. The glass conference room on the 22nd floor of Vascular Prime overlooked the rush of Boston below. Light bounced off the long oak table, making the room feel like a stage where a few people were cast as leaders, and the rest were forced to sit quietly and watch. It was the first meeting, led by Eleanor Garrison. 2 weeks ago, she was still just the CEO's daughter. Today, she walked in with a brand new title, Chief Transformation Officer, the one tasked with reshaping the company for a high-profile IPO. I had been here for 25 years, long enough to survive 4 CEOs, 3 restructurings, and countless meetings where people used the word modernization to cover up a lack of understanding. Across those 2.5 decades, I served as lead biomed engineer. The person who built the foundation for our minimally invasive heart valve platform is now valued at $950 million. It was thousands of hours of testing, nights spent in a lab colder than a New England winter, and those first surgeries where I stood behind thick glass, holding my breath for every beat. I knew my breath for every beat. I never cared about praise. I only wanted the truth to be named correctly. But in this gleaming room, truth felt like a guest waiting outside the door. Eleanor opened her laptop, pulled up a slide titled Transformation Roadmap, then scanned the room like she was surveying a battlefield. When her eyes passed over me, they rested for less than a second as if I were an outdated financial chart she no longer needed. "James," she said softly, so softly someone might mistake it for kindness. "You have contributed a lot to Vascular Prime, but we are entering a new era, an era of speed, data, and youthful energy, and you are a legacy bottleneck." The room froze. Legacy bottleneck sounded like something pulled from a tech conference, but it meant exactly what she intended. I was an obstacle, something obsolete, a piece of the past wedging itself into the story of the future. I sat upright, eyes never leaving hers. If Eleanor wanted shock value, she achieved it. But shock is not leadership. So I asked one simple question: what exactly am I obstructing? Eleanor gave the kind of smile people reserve for pitching investors. Full of confidence, empty of depth, the way we develop technology, the way we tell our story to the market. You have been here too long to feel the new rhythm, and sometimes innovation requires letting go. Letting go. A feather-like phrase to dismiss decades of labor, research, failure, and standing in the thin space between life and death every time a new device was tested on a patient. But Eleanor saw none of that. She saw clean marketing, bright financials, and the kind of vision you get from a generation convinced they understand everything after a few fast online courses. She closed her laptop and slid an envelope toward me. Termination. No explanation, no performance review, no thank you for 25 years. Just paper, an envelope, and a smile as thin as a supermarket receipt. A few colleagues stared hard at their screens or scribbled nonsense in their notebooks, pretending to be too busy to witness me being escorted out of my own history. I did not blame them. In times like these, silence becomes a survival tactic. Speaking up means risking your name on the next envelope. I signed, not because I accepted defeat, but because I had nothing to prove to someone who had never once stepped into the lab the day our first device finally worked. When I walked out, I heard someone clicking a pen behind me, as if the meeting had never really stopped. I walked down the long hallway, lined with photos of doctors and patients alive because of the technology we built. A young engineer passed me, opening his mouth as if to speak, but staying silent. I saw sympathy in his eyes and fear. Those two always traveled together during restructuring. When the front doors opened, Boston winds slapped my face, cold, sharp, honest. The emptiness that followed felt strangely light. Freedom often arrives disguised as a void. I stood outside the building watching people move along the sidewalk, unaware that Cardi Noah had just removed the person who laid the first brick of its most valuable technology. I was not angry. What I felt was stranger, like someone had lifted a heavy backpack off my shoulders without asking. Let me tell you something. You who are listening to this, tell me where you are watching this. New York, Texas, London, Sydney. or right here in Boston. Because if you have ever spent your life building something, you know the quiet sting in your chest when someone tells you that you no longer belong. I turned to leave. But before my foot left the last marble step, I remembered something, an old document from 25 years ago. A file only I would remember, a clause the company never revisited after surviving those shaky early years. I stopped in the wind, my hand brushing the worn canvas bag on my shoulder, and I thought I may have been fired. But the real conversation between me and Vascular Prime was just beginning. Walking along the Boston sidewalk after that cold dismissal, I thought the emptiness would follow me forever. But the farther I got from the Vascular Prime building, the more the old memories came back with startling clarity. Not the meetings, not the reports or the deadlines. What returned were those first days when this company had nothing but four walls and a fragile belief that we might change the way lives were saved. 25 years ago, Vascular Prime was not in a glass tower downtown. It began in an old warehouse by the Boston Harbor where the smell of sea salt mixed with rusted metal and the sound of container ships echoed every morning. The original office had 3 rooms, a meeting space barely the size of a closet, a shared workspace with a warped wooden table, and a lab where we had to pull new wiring ourselves because the old circuits could not handle the equipment. On my first day, I remember thinking, a place like this wants to save lives. But then I met Dr. Elias Thorne. Elias was a renowned cardiologist at Massachusetts General Hospital, but he disliked the noise and ego of big institutions. He came to Vascular Prime because he believed next-generation medical devices needed to be built by people willing to try, willing to fail, and willing to stay patient until the right answer finally appeared. He told me something I never forgot. We do not invent to impress the market. We invent so people do not have to die too soon. That one line kept me here for 2.5 decades. We started developing the prototype of the minimally invasive heart valve in a lab. So cold the windows rattled every time the cooling system kicked in. The earliest version was clumsy and heavy, not much better than a water pipe clamp. People laughed when they saw it, but Elias did not laugh. He stood beside me with a steady voice, as if commenting on the weather. James, solutions usually begin with things that do not look like solutions at all. In those early years, Vascular Prime nearly collapsed at least 3 times. Some months our account barely covered a single payroll cycle. I remember one emergency meeting because an investor pulled out an hour before signing. CEOs rotated through so fast we stopped learning their names. We were engineers used to pressure, but the pressure of wondering if you would still have a job next month was a different kind of weight. Yet every time I considered leaving, a patient would visit. A father standing after his first experimental surgery, placing a hand on Elias's shoulder in quiet gratitude. A young girl walking into the lab with a heart far stronger than any prediction. Those small moments kept me grounded. They kept me believing Cardiova had a reason to exist. But during that chaos, I learned something important. When a company shakes, people forget what belongs to whom. One night while we were inspecting the device before a major trial, our attorney Julian Croft came to find me. Julian was quiet, but every word he spoke mattered. He rested a hand on my stack of documents and asked a blunt question. James, have you filed the provisional documentation for the valve design under your name? I was surprised. I assumed the company handled it. Julian shook his head. With this level of disorder, if you do not register it yourself, you could lose control of it. And believe me, one day they will forget who built this. It sounded pessimistic, but Julian was not wrong. I had spent thousands of hours designing every material layer, every pressure parameter. I did not want to wake one morning and find it credited to someone else, because the company forgot. So we filed the provisional patent under my name, a quick, simple decision that would later become the hinge of my entire life. To let the company use the technology, I granted Vascular Prime an exclusive license. It was my idea. I wanted the company to survive and patients to benefit without legal complications. But Julian thought differently. He understood the law more than I did. He understood people more than I did. And he knew no one could predict the future of a company on the edge of restructuring. So Julian suggested one more clause, a single sentence tucked at the end of the agreement, a place no one bothers to read when a company is scrambling to stay alive. It stated, if the inventor is terminated without cause, ownership reverts automatically in accordance with Title 35, Section 261 within 72 hours. When I signed it, I never imagined I would need it. The company was fighting for survival, and no one cared about who owned what. The clause felt like a light in a room no one used. It existed, but no one noticed. Time passed. Vascular Prime stabilized. Our heart valve proved its value. The finances strengthened. New CEOs arrived and left. Each one tried to leave a mark. And through all that motion, the old paperwork drifted into storage, dust settling on provisions that had once mattered. By the time the company was strong enough to build its glass tower on Atlantic Avenue, the reversion clause had slept untouched for nearly 25 years. No one mentioned it. No one remembered it. They remembered the revenue the technology brought, not who created it or how it was protected. I had forgotten too, at least until the morning fired me. But memory is strange. It can sleep in the dark for years, then wake the moment you need it. Standing in the Boston wind that morning, I felt an old door swing open. I never thought I would need that clause. But today, the clause that slept for 2.5 decades is waking up, and it is not waking up gently. That evening, I returned to my small apartment by the Charles River just as the sun slipped beneath the horizon, leaving a ribbon of orange light stretched across the water. The wind moved gently, enough to stir the last dry leaves clinging to the balcony. I opened the door, turned on the kitchen light, and set my bag on the chair with a motion so natural you would think this day had been just another ordinary day. Strange how a person can walk away from a hard glow and still hold a calm that surprises even themselves. I made a simple dinner, reheated chicken soup and a slice of toasted bread. I was not hungry, but I knew I needed to chew something to keep my mind from drifting too far. I ate while looking out the window. People kept moving along the street below, car lights trailing like faint threads. None of them knew that this morning I had been pushed out of a place I helped build from the first brick. And none of them knew I was watching my own emotions the way a doctor watches the irregular rhythm of a patient's heart. No anger, no sharp pain, only awareness. It surprised me. I thought I would slam a fist on the table or at least mutter a curse when I remembered Eleanor's smile. But no. The feeling was like seeing a giant cloud from a distance. It looks threatening until you get closer and realize it is only a soft mist dissolving. I stood and walked into the small workspace next to my bedroom. I rarely use this room except to store old documents. On a low wooden shelf sat a gray metal box, the kind people use to keep important things they do not reach for often. I set it on the desk, brushed off a thin layer of dust, and unlocked it. Inside was a part of Vascular Prime's history no one but me remembered. Stacks of papers are mixed material invoices from our lean early days. Lab notes from the first trial. Photos taken with an old camera back when the heart valve prototype barely had a shape. I lifted each document, my fingers tracing numbers, scribbles, the uneven handwriting of my younger self from 2.5 decades ago. My hands did not shake, but the cold breath of memory still found its way in. People think the past sits far away, but really it just waits quietly in a drawer for you to lift the lid. I sorted through the papers until I saw a pale yellow envelope pressed at the bottom. The emblem of the United States Patent and Trademark Office is marked in the corner, impossible to mistake. I pulled it out and laid it on the desk, light enough that I could hear the paper rustle. It was the copy of the provisional patent Julian had filed under my name. I opened the envelope. The smell of old paper rose, familiar and distant at once. Inside were several pages clipped together, each softened by time, the blue ink fading along the edges. I read the first lines, minimally invasive heart valve design. Inventor, James E. Dunlap. Filing location, Boston, Massachusetts. Filing date, 24 years and 11 months ago. But what made me stop was the final sentence on the third page. The one Julian had suggested, and I had agreed to sign without imagining it might one day become the most important line of my life. If the inventor is terminated without cause, ownership of the technology automatically reverts to the inventor within 72 hours. I read each word slowly, the way a doctor re-examines an X-ray to see if there is anything they missed. Nothing was wrong, nothing was missing, nothing had been altered. The clause had waited there for 2.5 decades like a silent witness. It is remarkable. A company can build a new tower, change its logo, host extravagant events, and still fail to erase a single line of text once it has been signed and stamped into law. I leaned back in the chair and closed my eyes for a moment, not to reminisce, to confirm to myself that I was not imagining this. When I opened my eyes again, the yellow streetlight outside caught the pages just right, making the printed words glow. I picked up my phone, photographed each page, making sure every line was clear. Then I opened an email, entered, attached the images, and wrote one simple sentence. That morning, Manhattan looked like a stage built specifically for Vascular Prime. Clear sky, light wind, giant banners hanging along the entrance of the convention center shimmer under the sun. Clear's throat. They spared no expense on spectacle. The glass revolving doors were polished enough to reflect every person who walked through. Dozens of event staff in black suits with earpieces moved like a silent army. Inside the reception hall was vast enough for footsteps to echo. Bright exhibition booths, towering LED screens, looping videos titled The Future of Cardiac Care, soft electronic ambiance drifting from hidden speakers overhead, investors with gold badges, cardiologists from the most respected hospitals, representatives from the National Regulatory Agency, venture capital funds. Everyone was there. The crowd looked more like a technology award show than a biomed summit. This was the day Vascular Prime planned to prove it owned the future of minimally invasive heart technology. This was the day Eleanor intended to crown herself as the architect of a new era. And this was the day everything began to crack. Eleanor stepped onto the stage like a polished speaker walking into a TED studio. Spotlights lit up her pristine white suit. Her hair was perfectly styled, and her eyes carried the shine of someone who believed that speaking loudly and quickly could rewrite history. She opened her talk with a rehearsed smile. Greetings, everyone. Today we stand in Manhattan to open the next chapter of American cardiac technology. Her voice rang with practiced brilliance. Every line is packed with media-friendly keywords. Next era, transformative care, artificial intelligence-powered diagnostics, patient-centric innovation. The room sat silent, not because they were moved, but because they had heard speeches like this 100 times. The technology world loves promises that sparkle more than the truth behind them. By the ninth slide, two large words filled the screen. Proprietary technology. Eleanor lifted her chin as if presenting a priceless jewel. Our core technology is fully protected by patents and exclusively developed by the Vascular Prime team. She did not finish the sentence. In the second row, an older man stood, one of the largest investors, the very person Vascular Prime hoped would lead the next round of funding. He did not raise his hand, he simply held up a sheet of paper. I have one question before you continue. His voice was deep, steady, and carried the weight of someone accustomed to signing very large checks. Eleanor froze for a moment, but kept her smile. Yes, please. The man raised the document higher, so the lights hit the text clearly. According to the Patent Office database I checked this morning, this patent is currently owned by Heed, James E. Dunlap, someone I heard your company terminated this week. The sound fell over the hall like a stone. Within seconds, murmurs rippled outward in waves. Eleanor stood motionless, her smile frozen in place, the shape still there, but the life gone. She forced another smile thinner. Perhaps you are viewing outdated records. We own the entire technology. This must be a system error. What Eleanor did not know was that in that moment, nearly 300 attendees scanned the QR code had sent with their invitations. It linked directly to the patent database, and one by one they saw the same line. Owner James E. Dunlap, no error, no typo, no excuse. Several rows back, a representative from the National Regulatory Agency leaned toward a colleague and whispered something. They swapped a few credential cards, then rose to their feet. As they walked toward the aisle, the entire hall seemed to hold its breath. Eleanor saw them and turned pale. She spoke quickly. There is no need to worry, all legal procedures are. But the representative cut her off, speaking through a handheld microphone so no one could pretend not to hear. Demonstrating a medical device without valid intellectual property rights is a serious violation. If this continues, all data and devices presented today may be seized by federal authorities. The room fell into an icy silence. Some investors blanched. Others pulled out their phones to recheck the database. A few stood up immediately and headed toward the exits. No shouting, no chaos, but the scraping of dozens of chairs was enough to turn this multi-million-dollar event into a catastrophe within minutes. Eleanor clung to her script, but every word made her look like someone missing a step on a staircase and pretending nothing happened. She raised her voice. "We are actively working with the appropriate agencies. This is simply a misunderstanding." But no one clapped. No one returned to their seats. No one believed the lies. Another investor spoke loudly enough for all to hear. "I will not fund a company that cannot control its own core assets." Others followed him out, not hurried but resolute. There is no patience left for companies suspected of mishandling even a single line of documentation. On stage, Eleanor stood alone under the white lights. She looked down at her note cards as if they had suddenly been printed in a language she had never learned. 3 months of preparation turned to ash before her eyes. In the far corner, the sound team cut the background music. The LED screen reverted to its default state, as if it refused to keep displaying the presentation. No one scolded Eleanor aloud, but the silence weighed far more than any reprimand could. A staff member rushed onto the stage and whispered something that nearly made her collapse. It could have been news that the legal team could no longer contain the issue, or that the media had already received the updated patent data, or simply the final confirmation. "We are out of time." The chairman, Wallace, gestured politely for me to sit. "Thank you for coming, James. We want to understand the full picture from the origin of the invention to the legal clause you now hold." I opened my bag and placed a stack of marked documents on the table. No theatrics, no grand statements, just facts arranged in chronological order. I began with the early 2000s, the day a cardiologist and I tested the prototype in an old warehouse near the harbor. I told them about the near bankruptcies, the revolving door of CEOs, and the meetings where our budget could barely carry us another 2 months. I spoke about Morgan, the former legal advisor, who urged me to file a provisional patent under my name to safeguard the technology during the instability of those years. No one interrupted. No one looked impatient. They listened as if hearing for the first time the full story behind the product that had made them wealthy. Then I shifted to the legal structure. Exclusive licensing does not equal transfer of ownership. They are entirely different mechanisms, and everyone in the industry knows it. The reversion clause was added at the recommendation of our lawyer to protect the inventor if fired without a professional cause. The clause was never revoked. I placed the file down, and you did fire me, not for performance, not for a technical mistake, but after a 10-minute conversation with a new CEO, the clause activated automatically. A simple procedure of intellectual property law. The conference room door opened. Eleanor walked in. She tried to hold on to her confidence, but the tension across her shoulders betrayed the facade. She pulled out a chair, sat, and spoke immediately. "I want to make this clear, James. What you are doing is blackmail." I turned to her, my voice so calm it disoriented the executive. "Eleanor, I call it ownership. You might try reading the law sometime." One of the oldest board members lowered his head to hide a smile. Eleanor flushed but had nothing to say. I continued as though the exchange were nothing more than a passing breeze. Morgan, my attorney, opened his laptop and presented the rest. His tone was steady, like someone reading test results. "If Vascular Prime continues using the technology without legal rights, the National Regulatory Agency can suspend all clinical trials. Investors will withdraw completely. The company could face hundreds of millions in damages from litigation, not to mention liability if patients are harmed." Silence filled the room, not the tense kind, the kind where everyone finally acknowledges they can no longer pretend this was a misunderstanding. Wallace asked, "James, what do you want?" I looked at each person before answering. "I want the technology to continue saving lives, but I also want my work respected, so my terms are clear." I placed the proposal at the center of the table, an initial payment securing usage rights for the next 3 years, a long-term profit share for every device built on my architecture, a seat on the Medical Ethics Committee with authority to review decisions affecting patients and research, and finally Eleanor's resignation as CEO. For nearly 10 seconds, no one said a word. From the outside, it might have looked like they were analyzing a complex financial chart, but in truth, they were weighing the risk of every option in complete silence. Eleanor shot to her feet. "This is absurd." You are trying to destroy me and this company, I answered gently without changing tone. Eleanor, I am not destroying the company. I am protecting my work. Your position is between you and the board. One board member put his pen down. The soft click sounded like a period at the end of Eleanor's resistance. Raymond looked around the table, then said, "Let us focus on what matters, the survival of the company." Eleanor opened her mouth to continue, but he raised his hand. Enough. The board exchanged quick looks. They did not need a formal vote. They had lived long enough to recognize when a battle was already decided. Wallace turned back to me. "James, the board accepts your terms. We want Vascular Prime to move forward, and we acknowledge that it cannot happen unless we honor your ownership." I nodded, not in triumph, not in vengeance, just a balance restored. Eleanor scanned the room for support and found none. She left without looking at anyone. The door closed softly behind her, yet it felt like an entire era ending. I gathered my documents and rose. The board watched me as though seeing the foundation they had overlooked for years. Before leaving, I said one final line. I am not reclaiming the future. I am reclaiming what already bears my name. Vascular Prime's press release went out Monday morning. No stylized logo, no smiling Rand D team in the lab, no slogan about the future of medicine, only a modest document. Each sentence careful, like something written by the last person still thinking clearly in a kitchen full of smoke. It said three things. First, the ownership of the foundational patent had been updated in accordance with federal regulations and by agreement with the inventor, James Dunlap. Second, the company formally acknowledged James's role in the development of the technology, including the early prototype phase and the initial breakthroughs. Third, the company would restructure its senior leadership to ensure transparency in governance and adherence to research ethics. Anyone in the industry understood this was how a company tried to regain its footing after touching a boundary it should never have approached. Eleanor resigned with a single early morning email sent at 5:30. I am leaving the CEO position. I wish Vascular Prime continued growth. No thanks, no signature flourish, no accompanying image, an ending that matched the way she entered the crisis. Rushed, misplaced confidence alone. 3 days later, I returned to Vascular Prime, not as someone coming back for revenge, but as someone walking into a place where he had planted a small seed many years ago, a seed others had forgotten could grow. Wallace, the board chairman, greeted me in the lobby. No formal lines, no ceremonial handshake, just a nod, carrying the quiet gratitude people in medicine reserve for those who help patients live longer. They led me to the lab floor where my technology was being tested in its newest device generation. The doors opened and what I felt was neither triumph nor. It was the feeling of something finally being returned to where it belonged. The hiss of pressure monitors, the hurried footsteps, the sterile scent, the white room lights wash over stainless steel counters. Everything was the same as 2.5 decades ago, only cleaner, sharper, and far less improvised than the nights when I worked with research tools that barely held a charge. A young engineer approached, slightly nervous. "It is good to have you back, James. Your original design is still the backbone of the newest version. We are only refining it." I looked at the three-dimensional model on the table, the flexible valve lines pulsing with the simulated heartbeat. "Technology can evolve, but its meaning does not," I said. He nodded, eyes sincere. These younger engineers, even if they did not know the full story, understood the value of integrity in science, something Vascular Prime had misplaced for far too long. Leaving the lab, I walked to my new office. Simple. No leather chairs, no sweeping view of Boston, only a whiteboard, clinical documentation, and a small shelf holding an old photo of the original engineering team when the company first started. I opened the formal agreement that the board had signed. The initial payment was large enough for people to call it a financial victory, but the line I lingered on was short. Co-ownership of the technology, a role without a grand title, a position not built on authority, but it guaranteed one truth: no one would ever twist science into a ladder for promotion again. I set the document down and looked out the glass door. In the hallway, a group of coordinators escorted an elderly patient toward the testing wing. He moved slowly, but his face brightened when the technician told him he was a strong candidate for the new device trial. As he passed my office, he whispered to the person beside him, If this works, do you think I can make it to my granddaughter's graduation? I stood still. A single question like that was enough to remind me why I began this work, why I fought to reclaim ownership, and why I returned to the lab instead of walking away. Not to win, but to make sure the technology stayed exactly where it was meant to be. That afternoon, as the sunlight stretched across the Charles River in soft gold, I turned on my computer camera. I often recorded my story for those who followed the journey from the beginning. The people who understood that sometimes life needs a few corrections to remind us what truly matters. I spoke slowly, without raising my voice, without hiding the fatigue, and without hiding the resolve. I did not reclaim $950 million to celebrate victory. I did it to remind everyone that intellect cannot be fired. It cannot be rewritten in a performance review. It cannot be replaced by a pretty presentation. If you have ever been underestimated, I want you to know this. Your value does not disappear because someone fails to see it. If you have ever been pushed out of a door you helped build, do not assume the story ends there. Sometimes that is the chapter where you discover how much stronger you are than you ever imagined. I looked directly into the camera. Thank you for listening. If this story resonates with you in any way, subscribe. I have many more real stories, stranger than fiction, to share, and tell me what you want to hear next. I promise I will read every comment. I closed the laptop, not because I felt victorious, but because I knew justice only stands in the right place when someone is patient enough to put it back. And today I did my part.